Welcome back, everyone. John and I are appreciative that you're here, that you're curious about ocular issues. Today, we're going to talk about floaters. Floaters are a variety of something called the posterior vitreous detachment, which we are not going to discuss today. That's a separate video that we will do. But we're going to talk about the way the gel in the eye clumps and creates shadows or bugs or blobs as light strikes the floater and creates a shadow on the retina. And that can be disconcerting when you're reading or looking at the sky or that type of thing. So we're going to just, as I mentioned, talk about floaters or the blobs that are associated with it. I am a board certified fellowship trained ophthalmologist in Alaska, and my colleague and friend who I trained with back in New York, I think it was during the Pleistocene era, before plumbing, is John Ditkoff. John, you want to say hello?
Hello, everyone out there, all you wild and crazy people. So today I think the topic floaters, one of the most common things I see in my practice. I'm sure Carl sees it as well. Patients come in, I see this little thing floating around in my vision, little black spot. Some people say it looks like an amoeba or a black bug or a spider web. And as Carl's mentioning, today we're really talking about the benign floaters. The floaters are not really concerning, but they can bother your vision. They can be annoying. But when we see someone, we always recommend anyone that has a new floater, something that seems different or new, they should be seen and they need to see their eye doctor, and they should get a dilated eye exam. When we dilate the eyes, we put special drops in, makes the pupil big, and we can look at the retina, which is in the back of the eye. The reason we want to do that is a floater can really represent lots of different things. I mean, a floater could be pigment in the eye, blood in the eye, a vitreous separation. But today we're really talking about the more common thing, which is these little clumps or cells or debris that's floating around the gel. So when we look in the eye, we can actually see those floaters sometimes, just the way a patient sees them looking out, and they really mean nothing. They don't represent anything to be concerned about. And most of the patients, we reassure them. And over time, what's amazing is the brain in the eye learns to tune them out for most people.
Right.
But again, in a different video, we're going to talk about the more serious implications of floaters. Sometimes it can represent an underlying disease. That's why it's important you see your eye doctor.
Right. And I'll jump in. So something called suppression, where the brain can actually just suppress the floaters. Usually takes about 3 months. And I wanted to mention,
amazing.
Yeah, and I wanted to mention, John, when we dilate, we do something called scleral depression, where I take a Q-tip and after the eye is dilated, I look through the pupil and I push on the outside of the eye to see the peripheral part of the retina, so you can get a better view and understand if something is going on out there, and if I have to send it to a retinal specialist to treat with their techniques of laser or other types of technologies that they have. So folks, I just wanted to show you what the anatomy looked like. So as I mentioned, here is the anatomy of the eye that I'm talking about. And the front part is where the pupil is and where light gets through. And the back part is where the vitreous gel exists in the intraocular space. And this is where the floaters can occur. Mildly controversial, the American Academy of Ophthalmology's website, aao.org, does not recommend treatment, although you will see things on the internet that suggest you can laser the floater. Retina specialists every once in a while will do something called a vitrectomy to remove a floater if it really, really bothers the patient. What's your experience, John?
Yeah, I mean, I think we don't do laser in my office, but I have had patients go for it. Some have been happy with it, some have not. And the vitrectomy concept is a surgical procedure. I mean, you're going into the operating room with significant risk. So I think in a rare patient where the floater is present for more than a year, and to your point where people are still noticing it and they can't learn to tune it out, and it's really bothersome, they should consider that, but they have to really weigh the risk and benefits with their retina specialist.
Agreed. So yeah, and that would be a pretty in-depth conversation, because vitrectomy can cause cataract and sometimes even retinal detachment or retinal issues. So we wanted to talk about floaters again. Vitreous issues, vitreous detachment will be in a separate video, but we really appreciate all your eyes on us, so to speak. And Please like and subscribe. We will see you next time. And remember, folks, don't be afraid to eat carrots. Right, John?
Correct.
So long, guys.